do a good job when it comes to making teeth look great and giving people a healthy and beautiful smile. Aesthetic dentistry has boomed over the last decade or so, and many innovative techniques are now available to all of us. Now that the teeth look good, what about the perioral region? If we don't focus on the macroscopic environment and ignore the dentoskeletal matrix, then we may be missing the bigger picture. Whether we like it or not, modern dentistry does encompass facial aesthetics, and it's important that, as young dentists, we understand what it's all about. Many dentists have decided to further their skills in facial aesthetics for a number of reasons. Firstly, the demand is huge. Patients are keen to seek non-surgical resolution to the aging problem. Secondly, as dentists, we are more familiar with the working zone of the face compared to other healthcare practitioners. All the undergraduate anatomy and related science teaching comes into play here. Dentists also inherently have the manual dexterity skills required to carry out delicate work in a confined space. So, if this does interest you, you have an ideal clinical setup in place. There are lots of different types of treatment as part of facial aesthetics, but by far, Botox and dermal fillers are the most common. Botox is a trade name for botulinum toxin, which comes in the form of a purified protein. The mechanism of action is quite simple. Botox is injected into the facial muscles and blocks the transmitters between the motor nerves that innervate that muscle. Once the motor nerve endings are interrupted, the muscle cannot contract. Therefore, the dynamic motion that causes wrinkles in the skin will stop. The skin will then start to smooth out, and approximately 3 to 10 days after treatment, the skin becomes smooth. The effects of Botox last for approximately 3 to 4 months. Botox is commonly used for smoothing of facial wrinkles on the forehead, between the eyes, and around the lips. However, there are lots more uses, including helping to treat facial pain or TMJD. Dermal fillers, such as hyaluronic acid and calcium hydroxyapatite fillers, are commonly used to add volume to the face in the nasolabial folds, oral commissures, lips, and marionette lines. As we age, collagen is lost in these facial areas, and these lines start to deepen. These dermal fillers are injected right under the skin to plump up these areas so that the lines become much less noticeable. When speaking to the experts on how they see the future of facial aesthetics, there is a lot of excitement about understanding the biology and science of the human body and then harnessing the technology from within the body, for example, using platelet-rich plasma growth factors. Providing facial aesthetics is a choice, and you don't have to do it. Remember that you will ultimately be responsible if something went wrong. It is important that if facial aesthetics treatment does interest you, comprehensive training is a must. There are lots of different courses available, but you need to be trained by an accredited institute, which also provides a supportive network for when you do start seeing your first patients. You also need to contact your indemnity provider to cover yourself. Your fee will be more expensive, but if you carry out a few treatments, it is generally worth it. As always, make sure you're very particular with your medico-legal practice, including gaining appropriate consents and maintaining good record-keeping skills. Facial aesthetics is definitely one of the hottest topics in dentistry right now, and it seems as though the concepts from it are likely to influence the other specialties within dentistry. So, regardless of whether you decide to get involved or not, it is important to understand what's available so we can legally, morally, and ethically offer our patients the most appropriate treatment plans.